Welcome to Essential Tremor, Essential Facts for Patients. This informational video was created by Sarah Schaefer and Moises Dominguez in collaboration with the International Parkinson and Movement Disorders Society. Essential tremor, or ET, is the most common movement disorder. There are other names that are sometimes used for ET, including benign essential tremor, familial tremor, or hereditary tremor. Patients with ET may experience uncontrollable shaking or tremor in the hands, head, voice, or other body parts. ET does not shorten your life expectancy. Tremor may increase over time, but the change is usually slow, typically over many years. There are certain things that make essential tremor worse. Tremor is typically most noticeable when using your hands, such as holding the hands in a fixed position, holding a cup, using a spoon, or writing. It tends to worsen slowly over time. Stress often makes the tremor temporarily worse. Some medications and stimulants like coffee can also worsen the tremor. The tremor usually stops or gets much better when the hands are completely relaxed, such as when resting your hands in your lap. Certain medications and interventions can also improve the tremor, which we will discuss. The cause of ET is unknown, but more than half of patients have another family member with tremor. Researchers have not found the gene that causes ET. Researchers think ET develops in the brain, but the exact problem with the brain hasn't yet been identified. ET is a clinical diagnosis, meaning that the doctor makes the diagnosis by examining you. There is no diagnostic test for ET, like an MRI or lab study. However, your doctor may test your blood for other conditions such as thyroid disease that could worsen the tremor. There are treatments to lessen the tremor, but there is no cure, nor do any of the treatments stop or slow the natural progression of disease. Your doctor may recommend some daily lifestyle modifications that help, like using two hands to drink, using a lid or straw to prevent spills, using weighted utensils, or even wearing small wrist weights. Your doctor may suggest cutting back on caffeine, other stimulants, and some tremor-producing medications. Medications may be considered if the tremor affects your daily activities or causes problems for you. They are usually given on a trial and error basis. Some work better than others depending on the individual patient. Patients with certain types of tremor may benefit from botulinum toxin injections. Botulinum toxin is injected into the muscles that cause the tremor, temporarily weakening the muscle to reduce the tremor. These injections must be repeated 2 to 4 times per year and are only used with certain types of tremor. Although medical treatment may help some patients with tremor and should be tried first, those with very severe tremor may consider a surgical procedure. Your neurologist can advise you on the most appropriate treatment options for your specific condition. ET is about 10 times more common than Parkinson's disease. Unlike in ET, the hand tremor of Parkinson's disease is most often obvious when a patient's hands are relaxed and not when they are being used for activities. Other signs of PD but not of ET include slowness of walking and general slowness of movement, muscle stiffness, and other exam findings. In summary, essential tremor is a disorder of involuntary shaking movements or tremor. Tremor tends to increase slowly over time. Essential tremor is not a form of Parkinson's disease. Treatment options can include lifestyle modifications, medications, or surgery.